What is 5G technology? 5G stands for Fifth Generation Wireless Communication Technology and aims to revolutionize mobile connectivity. Building on the 4G technology, 5G offers much faster data transmission, lower latency, and broader connection capacity. This technology especially enables the widespread use of innovative applications such as the Internet of Things (IoT), artificial intelligence, and augmented reality (AR). The theoretical speeds of 5G can reach up to 10 gigabits per second, which is about 100 times faster than 4G. Since this next-generation technology operates on higher frequency spectrums, it allows many more devices to connect simultaneously. For instance, the wide bandwidth capacity provided by 5G is crucial in maintaining connection speeds in dense urban areas or crowded events. Additionally, 5G opens the door for innovations in fields such as industrial automation, smart cities, and autonomous vehicles. Another significant advantage of 5G is its low latency, which is critical for real-time applications. For example, in scenarios where surgeons perform remote operations using robotic surgical devices, or in online gaming where instantaneous responses are vital, the low latency provided by 5G plays a revolutionary role. All these features make 5G not only a faster communication network, but also a technology that will transform modern life. The effects of 5G on health. What does science say? 5G technology has raised concerns regarding its potential health impacts as it transmits data through electromagnetic fields (EMF). However, current scientific research indicates that as long as 5G operates within existing safety limits, it does not pose a significant risk to human health. Organizations such as the World Health Organization, WHO, and the International Commission on Non-Ionizing Radiation Protection, ICNIRP, have stated that the electromagnetic waves emitted by 5G are non-ionizing and cannot damage DNA. Nevertheless, some researchers argue that the effects of long-term and high-level exposure to electromagnetic waves need further investigation. Particularly, there is insufficient long-term data on the impact of the high-frequency millimeter waves used by 5G on biological tissues. Therefore, scientists emphasize the need for a cautious approach to the technology and for regular updates to safety standards. Research conducted so far shows that 5G, as long as it adheres to international safety limits for radiation, does not pose a direct health threat. However, to reduce public concerns and ensure accurate information is disseminated, it is crucial that independent and comprehensive scientific studies continue. This will not only facilitate the widespread adoption of the technology, but also resolve health-related uncertainties. Electromagnetic waves, the working principle of 5G. 5G technology uses electromagnetic waves for data transmission. These waves operate within a frequency range known as the radio frequency (RF) spectrum and can work across low, medium, and high frequency bands. One of the most notable features of 5G is its ability to utilize high-frequency bands known as millimeter waves. These bands offer higher data capacities and faster connections, but they are effective only over short distances, which means more base stations are required. Electromagnetic waves fall into the non-ionizing radiation class, meaning they cannot ionize atoms or damage DNA. The frequencies used by 5G are similar to those of technologies that have been in use for years, such as television and radio waves. However, due to the use of higher frequencies, some people are concerned about the potential effects of these waves on human tissue. It is claimed that energy absorption could increase in surface tissues like the skin and eyes. Current scientific evidence shows that the effects of 5G on human health are minimal as long as international safety standards are followed. However, research on the long-term effects of electromagnetic waves is still ongoing. Therefore, strict adherence to safety limits during the deployment of 5G networks and continuous updates by regulatory bodies are essential. This approach will help balance both the safety of the technology and the public's concerns. The rise of conspiracy theories. As 5G technology has become more widespread, numerous conspiracy theories have emerged claiming that it causes health problems. These theories are often based more on fear and misinformation than on scientific data. It has been claimed that 5G is responsible for various health issues, ranging from cancer and infertility to weakening the immune system and even spreading COVID-19. These claims have spread rapidly, especially on social media, fueling public anxiety. Several key factors contribute to the rise of conspiracy theories. First, there is a general distrust of technological innovations, coupled with limited knowledge about the technical aspects of electromagnetic radiation, which has fueled these fears. Second, the intentional spread of false information by certain groups has led to a wider belief in these theories. Particularly during the COVID-19 pandemic, completely unfounded claims that 5G base stations were responsible for spreading the virus caused panic among the public. The impact of these conspiracy theories not only increases public health concerns, but also delays the installation of 5G infrastructure, hindering technological progress. To combat these baseless claims, it is crucial to provide the public with accurate information and organize educational campaigns. This can prevent the spread of misinformation and encourage a more informed and responsible approach to technological developments within society. COVID-19 and 5G connection, myth or reality? During the pandemic, many baseless claims were made linking 5G technology to the spread of COVID-19. These conspiracy theories suggested that 5G base stations were spreading the virus or weakening the immune system, making people more vulnerable to the disease. However, scientific evidence completely disproves these claims. Viruses are biological organisms, and it is impossible for them to spread through physical energies like electromagnetic waves. The World Health Organization, WHO, and other health authorities have clearly stated that there is no connection between 5G and COVID-19. Despite this, such claims spread rapidly on social media platforms, leading to attacks on 5G base stations in some regions. These actions, driven by misinformation, not only created unnecessary fear among the public, but also damaged communication infrastructure, disrupting critical communication services during the pandemic. The theory connecting COVID-19 and 5G is an example of how disinformation can quickly affect societies. To protect the public from such false information, it is essential for health and technology experts to regularly share accurate information and promote reliable sources. This approach can help reduce the fear surrounding both COVID-19 and new technologies, allowing society to act in a more informed manner. World Health Organization statements on 5G. The World Health Organization, WHO, has conducted comprehensive evaluations regarding the health impacts of 5G technology and has taken an official stance on the matter, who states that the electromagnetic fields emitted by 5G, particularly low-frequency radiation, do not have the potential to harm human health. According to WHO, the radio waves used by 5G are similar to those used by 4G or older technologies and are non-ionizing. Therefore, based on current scientific data, WHO has concluded that there is no evidence to suggest that 5G has any harmful effect on human health. However, WHO emphasizes the importance of long-term research to better understand the potential health effects of electromagnetic radiation. The organization has stated that continuous research is needed to fully comprehend the effects of exposure to electromagnetic waves on human health. Consequently, WHO continues to collaborate with international health authorities to monitor the potential health impacts of 5G. WHO also advocates that all countries adhere to international guidelines when setting national safety limits regarding electromagnetic radiation. WHO plays a significant role in educating the public. As 5G technology spreads, misinformation and conspiracy theories regarding electromagnetic radiation have also proliferated. WHO participates in public education campaigns aimed at providing access to accurate information. These campaigns aim to reduce fears and concerns about 5G while helping the public become more informed about safe technology used based on scientific data. WHO's official position advocates for a scientifically grounded approach to the safe use of 5G and aims to support communities in adapting to this new technology in a healthy manner. 5G and cancer risk. Are the concerns exaggerated? Claims that 5G technology increases the risk of cancer are largely based on conspiracy theories and misunderstandings without scientific backing. The question of whether electromagnetic radiation causes cancer has been debated in the scientific community for years. However, the radio waves emitted by 5G fall into the non-ionizing radiation category, meaning they do not have the potential to directly damage DNA. The World Health Organization, WHO, and other health organizations have reviewed numerous studies on electromagnetic fields and cancer risk, concluding that there is no conclusive evidence linking them. Still, some scientists emphasize the need for further research on the biological effects of long-term exposure to electromagnetic radiation. The fact that 5G operates at higher frequencies has raised some concerns. However, current studies have not found any direct connection between 5G and cancer. The development of cancer is a complex process involving genetic factors, environmental influences, and lifestyle, among other factors. In this context, establishing a direct link between 5G and cancer would be misleading given the current scientific data. The claims that 5G poses a cancer risk are exaggerated, and there is no reliable scientific evidence supporting them. It is important for scientific research to continue in order to better understand the health effects of technological innovations. However, based on current data, 5G usage does not increase cancer risk as long as it stays within established safety limits. 5G infrastructure and environmental impacts. The widespread adoption of 5G technology, along with the installation of base stations and infrastructure investments, has raised concerns about its environmental impact. It has been observed that the number of base stations required by 5G is increasing, and these stations consume more energy. Specifically, because 5G uses higher frequency millimeter waves, it is expected that a large number of base stations will need to be established, each requiring more power. This situation may lead to an increase in energy consumption, consequently magnifying its environmental impact. Furthermore, the areas where these base stations are installed could affect natural habitats, potentially disrupting ecosystems and harming local biodiversity. However, various environmentally friendly practices have been developed to mitigate the environmental effects of 5G infrastructure. Some technology companies aim to minimize the environmental impact of base stations by using energy-efficient materials and designing systems that consume less power. Additionally, renewable energy sources, particularly solar power, are being utilized to supply energy to base stations in some 5G infrastructure projects. This approach helps reduce dependence on fossil fuels and minimizes the carbon footprint. Another environmentally friendly strategy is to construct 5G infrastructure using recyclable materials. This is an important step in ensuring that the equipment and structures do not harm the environment once their lifespan ends. Moreover, some projects focus on upgrading and reusing existing infrastructure, which can reduce the need for new base stations and minimize the environmental impact. These environmentally conscious practices are crucial for building a sustainable 5G infrastructure and ensuring that future technology usage takes place in an environmentally responsible manner. Public perception of 5G awareness campaigns. As 5G technology becomes more widespread, many misconceptions and concerns about the technology have emerged among the public. Particularly, conspiracy theories circulating on social media and the internet have reinforced unfounded claims about the negative impacts of 5G on health, security, and the environment. These misinforming narratives can lead to a negative perception of the technology. Therefore, ensuring access to accurate information and raising public awareness is of utmost importance. For awareness campaigns to be effective, the focus should be on reliable, scientifically based information. Health and technology authorities should educate the public using scientific research and real data. The media, governments, and non-governmental organizations all carry a significant responsibility in ensuring the public is well informed. To this end, various communication channels such as public campaigns, seminars, brochures, and social media posts can be used. Additionally, Experts and scientists should engage with the public, providing clear and understandable explanations about the potential benefits of 5G, its health effects, and safety measures. This will help counteract misinformation and alleviate concerns. Social media and digital platforms can play a crucial role in these awareness efforts. In platforms where misinformation spreads rapidly, reliable sources should be highlighted to make it easier for people to access correct information. For instance, government and independent health organizations can direct the public to trustworthy information through their websites, social media accounts, and video content. Furthermore, organizing training sessions to enhance digital literacy can help individuals improve their ability to access reliable information. In addition to these awareness campaigns, educating the public about the benefits of 5G technology will be effective in preventing misunderstandings. Future 5G and health research. The long-term health effects of 5G technology are not yet fully understood. Therefore, future research is of great importance. While short-term studies on the potential health impacts of the electromagnetic waves emitted by 5G exist, more data needs to be collected on its long-term effects. Such research will play a critical role in identifying potential health risks, protecting public health, and ensuring the safer use of the technology. Future studies are expected to more thoroughly examine the effects of long-term exposure to 5G on health. These studies should assess 5G's impact on areas such as cancer, neurological diseases, and cardiovascular health. Additionally, the potential changes in individuals' lifestyles and interactions with the environment due to the spread of 5G infrastructure should also be explored. By doing so, preventative measures can be taken to address new health risks, and the adverse health effects of 5G can be minimized. Another important area of research is examining the effects of 5G technology on different age groups, pregnancy, and vulnerable individuals. Particularly, the sensitivity of groups such as children, the elderly, and those with weakened immune systems to 5G should be a focus of health research. Furthermore, scientific studies on 5G can help provide reliable results that will educate the public. Regulations and safety measures based on these findings will help build trust in the technology and serve to protect public health.